All right, thanks, Julia. Healthcare is a topic everyone is discussing right now, and today our guest is focusing on healthcare here in Mississippi. And here to share with us about the Mississippi Healthcare Alliance and all the changes that have been made is Dr. Harper Stone. Good to see you.
Thank you for having me here this morning.
All right, yeah. Now, it seems like, with this Healthcare Alliance, you all have fostered some big changes. Just tell us about what's going on.
Well, we've been very fortunate to have really all the hospitals, physicians, the EMS people, nurses all come together in our state as volunteers to try to make a change in our state, because we've led the nation in cardiovascular death rates and heart attacks and strokes. And we started this in around 2009, and we were leading the nation in heart attack death rates. And in the last 2 quarters, we're actually below the national average on death rates from heart attacks. We've made a huge difference there. We've just rolled out our statewide system of care for stroke, and that was in January 25th. And that is to set up a system so that when somebody's having a stroke, to get the appropriate treatment to them in the smaller hospitals. If they need to be transferred, they could, but to give them the clot buster to maybe make a huge difference in their quality of life in the future. But really, we're very fortunate to have the volunteerism we have in our state where people work together. And we've just had a Dial Don't Drive campaign we've kicked off, because Mississippi takes longer to call 911 than anybody else in the country.
Yeah, I noticed this a lot about 911.
And
there's a whole campaign to get people to pick up the phone and call,
That's exactly right. We partner with Medicaid and the American Heart Association with this campaign. And what this is trying to get people to call 911 when they have signs or symptoms of heart attack or stroke. If you don't call a 911, it takes well over 2 hours before they finally show up in the emergency room. If they actually make that phone call, it's usually about an hour. And an hour to hour and a half delay can make a huge difference on whether you live or die, or you have a major devastating consequences from a stroke. So calling 911 is really what we're trying to push to get people to do in our state to make a difference in their long-term survivals.
Yeah, so a lot of this is just education.
It is
Educating
education.
People on the healthcare end, and also people at home.
Exactly.
Yes. And you're saying that this is volunteers that are taking this on to do this.
Yes. Again, it's like I said, all the hospitals and the physicians put swords down. Everybody's competing for patients, but this is something that we came together on and realized we need to put patients first, because we wanted to make a difference in survival in people in Mississippi, And
now I noticed on this paper that I'm reading, you're calling these rollouts. I guess there was the stroke initiative, there was the 911 initiative. Is there another initiative that's coming up?
Yeah, we just had the stroke rollout, where we're doing education across the state to all our smaller hospitals and our larger hospitals about what to do as far as quick treatment for people who have heart attack and stroke.
All right, thanks so much. We ran out of time. We'll be right back.